Cervical cancer is the fourth most common cancer in women. And according to the World Health Association, January is Cervical Cancer Awareness Month. Reagan DeTrolio joining us live with what you should do to try and prevent this type of cancer. Reagan, what are you finding?
Well, Jackie, doctors are urging you to get screened early on. Now, that's because the screening guidelines have changed drastically over the years. Now, you can see some of those guidelines right here on the National Cancer Institute's website. And doctors over at Cox Health told me cervical cancer used to be a much bigger issue back in the 50s and 60s. But since there's new technology and also new vaccines available, it's not as huge of a problem. But that doesn't mean you should neglect getting checked out by a doctor, especially since more than 14,000 women are diagnosed with invasive cervical cancer each year.
There's still a segment of the population that does not get cervical cancer screening for whatever reason, whether it's financial, whether it's social, whether they just don't have access to care. That's where we still will see women having advanced cervical cancer when they're first diagnosed. That would be one thing, that get screened if you haven't been. We see people who come in with advanced disease that their last Pap smear was when they had their last child, and that child might be 15, 18, 25 years old now, and that's a problem.
Now, there's also free breast and cervical cancer screenings available right here on the Missouri Department of Health and Senior Services website. So if you don't have insurance, we've still got you covered. We have all this info in this story on our website. But for now, live in the studio, I'm Reagan DeTrolio, KY3 News.
Not something to put off, Reagan. Thank you.